Very good evening for today, my beloved colleagues. Hopefully, all of today are fine in your good health. So, can I expect someone to respond? Is the voice is okay and the screen is clearly visible? Can anyone respond, please? Hi, doctor. Can you not hear me? Anyone? Sorry, anywhere problem to listen my voice? Dr.
Yes, you
Dani,
are audible.
audible?
Yes, you are audible.
Okay, thank you. Thank you very much. And can you see the screen, doctor?
Yes.
Oh, okay, that's all. Fine. So, welcoming you. We're going to start our talk today. And this is my humble introduction as before to you. And today, actually, what we will tell, this is the issue, and it is very exceptional one to talk on the very technical issues of the preparation, not any specific topic today. What we usually convene regularly, and most of you join. And today, specifically or mainly, we invited the new colleagues, those who are planning for AKT exam. Even then, if any previous colleague expert, rather to say, or experienced one is here, no doubt, if you have time, you will get the benefit also. Could be some informations might be repeated as well. But those are very new. I am requesting all of you to be connected with us. And today we will try to concise the discussion and time maybe a few with minutes rather, not to cross the hour also. So you can get ready with your other schedules and everything for today's session. So with this one, this is our um, institute name, and just to give you a knock now, a very traditional common disease, and almost those who are regularly seeing the patient from the musculoskeletal point of view, you will get it. Suppose a patient, I'm reading for all of you, just follow me and you will give your decision, what you like to give the decision. And if anybody before heard the story, please you don't answer it. We expect that any new colleague will answer the question. A 45-year-old woman attends with foot pain. She reports she has had pain affecting the underside of her right foot for the last 3 to 4 weeks. She denies any injury or trauma. The pain is worse when she wakes in the morning and takes her first few steps, and after she has been rested for a prolonged period and then gets up to work. The pain locates to the posterior third of the plantar aspect of the foot. On examination, you are able to reproduce the pain with firm palpation about 4 to 5 centimeter interior to the heel. There are no other examination findings of note. Which of the following is the most appropriate imaging to perform at this stage? I believe that most of you know the diagnosis, probable diagnosis, and other things. Can anyone to respond in this scenario, please, to say something? Especially any new colleague, I am requesting to respond. What will you do? Dr. Amena, welcome, please. What will you do? What imaging will you do? Dr. Amena, we cannot hear you.
I think
Nice. It is okay.
that
Please, what is your decision?
I think I think plantar fasciitis.
You are thinking something like plantar fasciitis, or could it be calcaneal spar also?
Yes.
Yes. So theme and things seem to be simpler to diagnose, right? What do you think?
Right.
I agree with you. I don't differ.
Maybe play next day. I
I
will go
don't
for
differ.
first.
So what now the question, answer the question. Actually, we will try to learn something, the technique of AKT preparation. For this, I open this up, not that to test your knowledge and other very critically. Dr. Amena, sorry, cannot hear you. What will you do in the imaging?
Plain X.
Plain X-ray, maybe plain X-ray of the heel, is it? What we practice?
Yes.
We usually practice X-ray both heel lateral view, if both heel pain is there. Or if single heel, we can focus on the single heel, that X-ray right heel or left heel. Usually a lateral view is enough. This is our regular practice, okay? But any different opinion who can put forward? Any other colleague thinking something different? Dr. Amena only the new colleague today for AKT aspirant. Why not other? No one to say further. Dr. Daniel, yes, doctor, please.
Yes, I guess we have established already, suspicion of having plantar fasciitis. Maybe we don't need any imaging.
No need.
This is
Fantastic. So didn't you do before, doctor, in your practice, any imaging?
uh,
MRI,
we,
ultrasound or
yes,
other? Didn't
no,
you
we
do?
no. Most of the time, if we have made a diagnosis of it, we are not usually doing it here.
Why not doing? The facilities are not available for that?
No, apart from facilities, but we give a first trial of any medicines. If
Okay.
if it's improved or not, and then after that we go for any imaging.
Actually, medicines do very less in this situation. That means our traditional painkiller, oral tablets and others.
Yes,
Patient may
yes,
need some other thing other than medication also for this thing.
yes,
But
yes,
for the diagnostic purpose and others, Dr. Amena said she is to do X-ray. So you are thinking not to do X-ray. So any other colleague,
yes.
Dr. Mello, so far I could see. Dr. Mello, can you open the mic? You opened it to say something? Quickly, please.
Yes, I also think no imaging is needed.
No imaging needed. Again, I am asking you if you don't mind. That means you don't advise any imaging in this situation.
Yes, at the moment, no.
Yes. But if you ask me, okay, Dr. Miller, or somebody ask me what I do by myself or what I have done before, actually, I advise X-ray. So do you contradict with me now that why did I do and I am wrong to prove me? Anyone? Now you are thinking that there are difference of opinions from different practitioners. Situation differs. Patient's expectations differs. Okay. And sometimes our diagnostic accuracy differs. In those situations, we may decide differently. I don't like to say these are irrational, but we are here to talk on the preparation of the exam. This is a separate thought process which will be prevailing in our mind. So in the exam purpose, what actually standard way, what could be the answer here? That is, we are searching. Dr. Amena, please, and other also be alert and to see. So your diagnostic accuracy is there very nicely. How much information should we need to tell that this is spare in the calcaneal bone or the plantar fasciitis? No more needed. That's all. More than 90% informations are here. And even undergrad doctor also or student also can identify this and diagnose. But now in our practicing life, the examiner testing our investigation, what I say, sometime I said, and we have planned to talk on more also, the planning of investigation. So how to plan and what to be done. So you see that for the diagnostic purpose, for further management, no imaging is the best choice here. So I think that this is a little deviation from our day-to-day practice. Again, I like to say your decision to do the X-ray or even do something else also, it is not irrational. Sometimes guidelines also guide us in country to country. Remember, the guidelines is not specific for throughout the world. Suppose if we have guidelines in my country and it is mostly based on scientific background, we are following it. But very sorry to say that all guidelines, especially in the South Asian countries, are rather to say not up to the mark. Sometimes we have to follow the standard guideline, especially from UK, USA, or other country. And in the exam purpose for the AKT, what we are following? Who can say what common guideline we are following for many diseases? Doctor, please try to respond.
I guess nice guidelines.
Fine. Mostly nice guidelines. In addition, for other diseases, there might be some extra additional for asthma, some other disease for osteoporosis or sometime few exceptional, but in general, this is nice guideline. So we have to follow the nice guideline. Even in the exam also, what is the nice guideline decision we need to know. Okay, let's move. I stay a little more time here to storm our thought process. And this is the thing why we will not choose imaging. This is the explanation. Okay, I don't like to talk on this too much. Just I like to say you that your decision in the practice may be a little different than your answer in the exam. So this is the AKT preparation tips. We started with one now. So we will not show you now many scenarios. Now how to start with study and reading, gathering the knowledge and others. Definitely you will tell, we will read the book. Doctor, which book is important? Anyone? Please be with me. Usually I feel better. Yeah, Dr. Daniel.
Expert Handbook of General Practice.
Do you mean that this one? This one?
Yes, yes, sir.
Because we are always telling this about even in the YouTube anywhere. You're very, very right, right? Okay.
Yes, sir.
Have you seen the book size?
Actually, I haven't seen, but I have a PDF of it.
That's all. That's all.
Yes.
But believe me, every day I read the book. Understand? And those who know me before, I am actually medicine specialist in my office, in my chamber. Okay, but I read this book during my practice every day, almost every day, learning many things. And a hard copy in my chamber in the table, and the PDF, with us also. If somebody who have seen it, please, anyone can say who have seen it, hard copy.
I have seen it. The
You
hard
have seen
copy
it.
I have it.
So
It's
can you
so
tell me,
pretty.
Dr. Amena, if you start this book to read, how many months or years you need to finish it? A
At
technical
least 3
question
to 5
asking.
years.
How many months?
It's so thick, sir. At least 1 to 2 years.
2 years. But you are planning maybe AKT after 6 months or 1 year, right? Maybe in the next November or after that, the May of the next year. Is that it?
Planning for November,
Yeah,
sir.
most of you almost this planning. So how can you prepare yourself now if you go through the book like this one even?
That's why you are here, sir, to have knowledge how to study this within few months.
It means we have to get idea of techniques how to prepare with the exam preparation. This is the thing. For this reason, we are here together as much as possible. We will learn. And even not only this book, you might have or you will have some other reference also. You see, it is given by the Royal College. Okay. Though I have highlighted this one, clinical evidence, British Medical Journal, and other things. So do you think that I am actually discouraging you to read it, Dr. Amena?
No,
Do you
sir.
think that actually no? Book will be our reference material. Okay. We have gone through many books in our life, but as our profession is is actually skilled base. Book is not the only thing. And we are appearing an exam. So this is different thing also. So we have to adopt the techniques to prepare this thing. So we will tell you now one by one how to start with. Okay. So today's session mainly comprising this thing, how to study SBA, because in the AKT already, you know, in the meantime, these are the SBA pattern, single best answer. Then we will talk how to attempt our mock or exam questions. Mock means in those who will be using the module, you will get the mock bundle as well. And in the exam time means real exam time, how to proceed. So now you understand that we are trying to explain you that the study SBA is a little different than how to attempt mock or exam question. Remember it. So try your best to identify this difference from today's discussion. And finally, how to make an organized AKT exam preparation. That is, we will tell our thing also what we can do for you. And first of all, we need to know the topics of syllabus of the AKT. There is a PDF available in the group or somewhere. If you need, we can provide you in an updated form. Actually, PDF will tell you the main headlines of this, just to have at a glance something system-wise. What are the topics Royal College prefers to include in the exam? And we need to know that if we are appearing the South Asian pattern, there is some extra fascination in the South Asian context. Okay, so if anybody interested, you can communicate with us. We will provide the PDF to you personally, no problem. And so the AKT preparation tips is the today's topic mainly, and we are starting to say you something stepwise. So in the step 1, what you need to do, always we need to do or select a system, what you are poor, right? Cardiovascular, respirology, many other systems are there. I don't like to ask one by one today what you are poor with. You can select, because you need to cover this thing early. But during selection, it is also important that the system which is less important in the exam, we don't need to pay more attention there. So how to select the system and others, we discussed in our session, they are also available in the YouTube. But today I told you we will confine very focused points. So whatever you select the system, you need to view the lecture if available. For example, why we are telling view the lecture, because we are providing the modules others, and even in the trial version also available in the group, and even in the anywhere. So according to the system, you participate in a lecture, wherever it is a live lecture, recorded lecture, or real-time lecture if possible. But most of the candidates actually don't have enough time to follow 1 hour, 90 minutes or 2 hour escaping from the job or family issues. For this reason, you know that we prepared the recorded discussions. So actually it is not the lecture, it will be the discussion. One-way lecture is not a good learning method. So from our side, it was actually discussion. So not required topics, further reading for you. From the lecture, you will understand that, oh, I need to know these topics further. So make a note in your notebook, paper or somewhere. After that, then the organized learning material you must have. We'll tell you the organized material. Some of you know in the meantime. From this organized material, you could see some relevant slides. Slides are interesting, comfortable to view. All are the same knowledge informations. And in the Oxford Handbook already, you have seen that all information is almost there, but not in a very palatable manner to learn, right? So relevant slide we prepared for you according to the system, and covering many other things also which are not discussed directly in the lecture, and it will give you full confidence upon the system. And if you want to have detailed discussion, so go through the question banks. Usually you prefer the past medicine. We also prefer one by one, we will go through, keeping in the mind your time also. So we will tell you about the time limit later on. So after the discussion, how to see the question bundle or question bank. This is important. You see, when you go through about a topic of ischemic heart disease, then you have to select the different the types of ischemic heart disease and others. So we like to show you about the hypertension, for example. We arrange this material accordingly. You can see the hypertension according to the alphabetic order. So you see how many topics we have selected as much as possible. So these are the hypertension topic, diagnosis, management. These are the question and in the doctor's actually life, right? Like prescribers or the practitioners. So just you see, these are the hypertension related direct topics. Whenever you want to finish the hypertension, you must go through these together in the what I don't like to say the single sitting, but continuously one day or in the 1 hour or 2 hour. I hope to read these half an hour to 1 hour is enough, because hypertension is a very common topic we are practicing day to day, and you definitely have some basic knowledge of hypertension, but how to prepare for the AKT exam, that is in the context of AKT, what you need to know, these are given here. So you finish it, hypertension primarily, and then for another example, you see the osteoporosis, the geriatric medicine, rather to say, osteoporosis related topics, all are there. There are some MS Word and other, but you will get in the bundle all of the PDFs. So it is not a very big one, as MS Word files are there. For that, it looks double. Actually, it will be less. So don't worry. It will be very big things. Don't be afraid. Especially if you see that assessing the risk, there are many files are there. So we will find that very common discussions are there in each and every file, but scenarios are different. Patient's description is different. For this reason, many files are here. So within short time, you can finish it. So everywhere like this topic. So after finishing this topic, for example, already how to read the SBA, we will tell you a little now, but a detailed discussion given, you could see in the link also in the YouTube. We will not show you now today. These are active YouTube link, how to read SBA. Now for simple example, may I request Dr. Amena to read it for us, just to be
Yes, sir.
energized. Please.
A 67-year-old male presents with dyspepsia, which started about 2 months ago. He thinks he has lost some weight. On examination, he looks a little pale and has some angular stomatitis. What is the most appropriate management strategy?
Right. It means that you already got the diagnosis, probable diagnosis. For this reason, you will have the plan of management. What do you think, Dr. Amina? Anyone? What what will you plan for the management? Can anyone say directly? Dr. Daniel, what will you do? This is your patient.
Yes, I can think of like going for some investigations.
Investigation. That means in the management part, you are thinking investigation. You are very right. I don't know, did you attend our OSCE session maybe in the last week? We told them one of the OSCE skill is management skill, and the management skill includes investigation skill also. So you are thinking that I will investigate the patient first. Why you are thinking not to give direct some management or treatment? What you are thinking so? Might
Uh,
be something different understanding there. Please.
yes, uh, in order to establish a proper diagnosis and to look
What we are thinking proper diagnosis? Where is the disease? What could be the disease?
yes, yes.
Okay, so what you are thinking? What is the disease and where is the disease?
Because it's a dyspepsia, and along with it, there's a loss of weight.
No, where is the disease
And
means? Where is the
so
disease
I can,
means? GI tract? GI tract, right?
yes, GI tract.
Preferably in the upper GI tract?
Yes,
Upper GI tract. So
upper,
if
and as well as we can also think of risk of the lower as well because of the age.
lower, Dr. Dyspepsia is the features of the upper,
Okay,
mainly
upper,
upper GI tract. This is the way how to say where is the disease. Symptom will tell us. This is the
all
understanding.
right.
Okay. So now we have to develop this understanding. We are practicing doctor, not undergrad student. So we have to think where is the disease? What could be the disease? To identify your thinking, that we have to go for the investigation. Dr. Amena, what investigation you could plan?
Endoscopy.
Endoscopy. Why? We are thinking some disease in the stomach. Endoscopy means upper GI endoscopy or colonoscopy.
Upper GI, sir.
Upper GI endoscopy. Dr. Guna Ratne, right?
Yes.
Please.
Full blood count. Full blood count.
Full blood count first. Why, doctor?
Because we want to check whether there's any deficiency in the vitamin B or folate or
Okay.
zinc.
We could get some idea, no doubt. Anyway, be with me, Dr. Gunaratne. Don't switch off.
Okay.
So to decide this thing, you need to identify the keywords. Actually, we are telling some technical point how to read SBA in your learning material or question bundle. Okay, we are not discussing the details of the disease today. So there are some 67-year-old, the advanced aged, weight loss. We tell it some red flag. Is it red flag?
Yes.
But we are dealing a patient of dyspepsia. So dyspepsia with the red flag, little pale, patient is anemic. For this reason, we could say, okay, my plan will be CBC. Isn't it?
Yes.
Fine.
Yes.
Including angular stomatitis, there might be some nutritional problem.
Yes.
And it may be features of the iron deficiency. It may be features of the vitamin deficiency. All are right.
Yes.
Okay. But the question is, what is the most appropriate management? Most. Sorry, I did not mark it for today's discussion. I have to mark it also here. Most. Intentionally, I marked it most. Dr.
Because the
Gunaratne,
age,
do you like to review your answer?
yes, sure.
Why?
Because the age and he lost some weight. So it means
No. Thing is that most means which will be very valuable investigation, or even the management also, not investigation. If you want to give any emergency injection, for example, okay, so it could be the most appropriate management strategy. So you are thinking now, but actual exam situation is not like this. But before going for the decision making, we have to think for 1 or 2 seconds what I would do in my chamber or in my practice. Now look at the options. This is your final part to decide options. So all of you look at what could be the best management strategy. Again, it will be the most, sorry, I just jumped here, most. Now, could you decide? Advice, treatment, refer for the X-ray, refer for gastroscopy. Gastroscopy, you understand this. Endoscopy, Dr. Amena. Possibly you plan for endoscopy, Dr.
Yes, I can.
Daniel also.
Yes, now I can think of a test for H. pylori.
H. pylori, okay, H. pylori. So many things we should have in our mind. So what will be
but sir, there must be some weight that is significant, and the
okay, so okay, this is the explanation. Decide now, Dr. Gunaratne, what should you do?
It said there must be some sort of CA around his gastric.
So you are suspecting some cancer in the stomach.
Yes.
So Dr. Daniel thinking it could be related with H. pylori, right? Now here is the difference of level of understanding. Some doctor will think H. pylori only. Some doctor will think malignancy. Now, most appropriate again, what could it be to identify H. pylori or to identify malignancy?
I think it's
Dr. Daniel,
malignancy.
you will tell
I think
malignancy, I
it's
understood. Dr.
yes.
Daniel now, what will you think?
Yes. I will think of malignancy, sir. Like
Now
it's
you are thinking malignancy after our discussion, and
yes,
definitely you will
yes.
switch from the H. pylori detection to endoscopy,
Endoscopy. Yes,
right?
yes,
Just
sir.
Yeah.
try to follow my discussion, doctor. These are very basic of the thought process development. Okay. So initially you may have time to understand these things. Okay. So this is the way of learning for AKT preparation. By looking the patient age and other. Your book will not tell you, even I prefer also, I told you that the general practice, Oxford Handbook of General Practice, they will not guide you directly in this way by telling these are the keywords, this is the decision. They will tell you some basic thing. But for the exam purpose, you need to read the SBA in this manner. And they will give you the discussion definitely followed by this. For example, before going this description, it is just our class strategy, how we will show. These are the red flags. We are getting many red flags are there, especially red flags to identify dangerous disease. And here we are suspecting cancer. This is the most dangerous red flag. Okay. This is called
Got
alarms. Alarms O55. This is our mnemonic, alarms O55. They will just customize this mnemonic, though we don't prefer mnemonic more and more. And these are the discussion. Ruling out any alarm symptom. This is priority. It may not be a malignant case, but we have to exclude it first. This is the way of learning of SBA, doctor. And after reading the SBA, then if you finish the system, go for system mock with a score with the explanation. Everywhere, those who are having any hard copy or soft copy of the past medicine, past it, whatever, you can see there. We prepared for that. We are highlighting this thing in a systematic way. Our system mock is a digital system, better. You cannot give by hard copy because these are our online program. So after going for the system mock with the explanation, you can assess yourself that how much you are prepared for the system. Note further query. After examination, you will find that you are missing some, you are wrong in some answer. Then you understand that you need to go back or explain or ask or share something. So already you have gone through lecture, you have gone through learning slide, you have gone through question bank. So what's resources you are having? You are having more resources. But technical thing is that if you go through more resources, is the time is in your hand. Already I have shown you literature, journals, many things are there. If you don't have the time, so very practical way is to discuss in a group. It will save you time and enlarge your understanding. For example, our group is the AKT WhatsApp group are there. Many of you, maybe today, all are you connected there. As much as possible, we are sharing some information. Even if you discuss each other, we will not mind. Everybody can have the access there for the discussion relevant with the topic or AKT preparation. So we are monitoring this thing. So here also, you can discuss any other topic also. So this is the way, discuss in a group, then things will be clear. Okay. So if you have the time, then you see even the whole guideline. We discussed the NICE guideline, other thing. It is definitely a reference. But if you start to read the guideline, it may take 1 week time. So how we can utilize our 6-month planning or 8 months planning for the exam? So if you have time, so you have to divide the time. We will show you, already you have seen maybe in our module. In a limited time slot, don't cross the timeline. Otherwise, you cannot finish your whole preparation. So textbook and other, everything will be in your hand. So if you have time, go through there. So up to these, you prepared yourself for the first stage or first step. Then come to the second step will be mock. Usually mock be attempted before the exam time. Initially, you finished one system group mock. Already you have seen tagged with each system in the preparation of the system. Now What we have designed actually we need to highlight it. In the second step, study the recall question before attempting the complete mock. And there are one additional system mock also there, though we didn't highlight it today in the slide. But before this complete mock, you may have some other learning material also, doctor, not from ours. As we have our material, we are adding this, that we have second set of the system mock. So before the exam, maybe 2 weeks, 3 weeks, or even the 1 month, study or attempt the system mock second set. Then the second time you are evaluating you how much you are prepared. Okay. Then you definitely you would improve yourself up to the mark. Then before the exam, before attempting the complete mock, we request you to see the recall discussion. These are the records. For example, in ours, we have maybe around now 15 records. We updated these. Some of you attended our previous AKT maybe in the last month or before after the exam, AKT exam, including those who passed with them also, or maybe 3 days we set. So in the 3 records also updated in our module now. So complete there. So recall questions. You will increase your confidence. And from the recall, somebody informed us that they face some common questions. So these recalls are very important. After looking the recall, then attempt complete mock. And in the complete mock, it should be uninterrupted, 3 hours, 30 minutes. So select a day when you will be free for 3 hours, 30 minutes. Definitely you will attempt the mock in your room, in the house, or in workplace or somewhere. So your internet should be okay. Your time should be separated and spared. Okay. It should be uninterrupted. And usually we advise to appear the complete mock minimum 5 to 7 days before the exam date. You can start even 10 days before also, no problem. Because we provide here 2 complete mock. So if you appear 1 complete mock, 200 questions, definitely you will get something you could not answer. You need to read further also. So keep some space to appear the second complete mock. So second complete mock to attempt maybe 1 or 2 days before the real exam date. Likewise. Then you are prepared. You are prepared. Now, at the time of the exam day, what you could do? You will find some questions are text based. Only text are there like this. So we will not be busy too much. This is scenario, and mainly a patient presented for the repeat blood pressure reading without any symptom. Okay. So what is the best next step? So in the keywords are there. We are a little speedy now. These are the 3 different times blood pressures are there. Patient does not have any risk factor for the cardiovascular disease, but age a little advanced, 58 year, BMI 24. So what will be the best next step? So answer will be not directly shown here. You need to go through this thing to remember the memory, the knowledge of this. The blood pressure is 140, 90, a little more. Your decision will be ambulatory blood pressure monitoring. So this is the arranged ambulatory blood pressure monitoring. This is the answer. Okay. That means how you have gone through your SBA. Likewise, you can select this thing. Identify some keywords and then decide. Okay. And in the reading time, again, in the reading time, Dr. Amena, please, can you connect now? You have gone through before your SBA question bundle, right? But in the exam, who have gone through one question before? You maybe? In the upper GI dyspepsia patient?
Yes, sir. Yes, sir.
You have gone through. Now I am giving you a chance again. In the exam day, how will you read it? And I advise you not to read in a similar manner. In the exam time, inside the exam hall, how will you read this question? Do you understand what I mean? You need to read in a manner so that you can save your time. So how to read it?
The keywords I have to.
No,
I
no, no.
hope to figure
You
out
read.
the keywords.
Can you read today for us? Whatever is speedily, but don't missing important messages also.
Okay.
Don't you understand?
58 years.
Okay.
58 years old lady with maybe with the blood pressure parameters I will read.
Okay.
No history of family, hypertension, BMI, and no smoking history.
Maybe like this. Maybe like this. Can I request any other colleague to read it? These are the practical thing to practice today also. And the inside the hall exam room. How will you read it? We discussed maybe in the last week, AKT, those who passed with them, some technical thing. Dr. Daniel, you are very enthusiastic. Quickly, doctor.
Yeah, yes,
How will you read
yes,
it?
sure.
How will you read
So,
it?
I will read like a 58-year-old lady, then seen by two colleagues, found reading of 142 over 92
Okay.
and 150 over 88. Today's blood pressure 140 over 44 over 82.
Okay.
And I will check history, family history negative, BMI 24, does not smoke.
Fine. I think almost all of you could get the point what I mean. So in the exam, we need to read like computer tab. Isn't it? Computer tab, jumping. Otherwise, you will not save the time. I can remember our Dr. Ramesh is from actually Sri Lankan colleague. Today, possibly he is not here because he passed. And he advised also because he learned from maybe not from us, I like to say, he learned about, we discussed many times. In the exam time, you need to identify the keywords. Always, definitely will be very concentrating and attentive to the question. So these keywords you need to identify in a jumping manner. Even 58 lady, not to read year old, right? Dr. Daniel, where? Please be connected.
Yes, sir. I'm ready.
Because gender and the age is important. 58-year lady, repeated blood pressure reading. Okay. Last 3 months, 2 colleague, 142, 92, 150, 88. The blood pressure is 122, 82. No family history. BMI 24. Does not smoke. This is the way. And you could save 50% time in this way. Okay. That is the thing.
Yes.
That is the thing. And now check the answers. Check the answers. Okay, then choose. This is the one way. Another way, though it will not fit most of the time, I think, is to check the option first. A, B, C, D, E. This is another technique. The A, B, C, D, E, then go back in the scenario. Okay, sometimes some text-based question may be useful in this way. But in the pictorials now, for example, it is one of the example of the question. Who will feel better to read? Dr. Amen again or any other? Just to read, to take part in our discussion. Huh? I will feel actually better if any. Dr. Daniel, please.
Yes. A middle-aged male present with a dynamic dystrophic nail plates as shown, along with an itchy rash in both sides of groin of 6-month duration. What is most likely diagnosis?
Okay, below 5 options are there. This is a standard question, picture-based question. But remember that picture-based question means mainly challenge in the picture. Okay, Dr. Daniel, if possible, be connected just to chat
Yes,
with me
sir.
personally like that. If you have time,
Yes.
I will feel better.
Yes, sure.
Otherwise, one-way
Yes,
discussion, I
I'm with
don't
you,
want.
sir.
Thank
I'm
you,
with
thank
you.
you, thank you. So if in the, this is the philosophy, picture is the main challenge. The informations are helping. Okay. So could it be like this for your answer without going through the, it is called the stem of the question, the text, without text? Is it possible to say the diagnosis? May be possible, may not be possible, right?
Yes.
Sometimes possible, no doubt. Because picture tells 100, not 100,000 words. One
Yes.
picture too much forceful to deliver the messages. If you are able to get the message from the picture. Those who have seen our picture tricks and tips of the picture, YouTube available also, you understand it. Not only for you, even for the MRCP Part 2 exam, we discussed it. So from the picture, it could be fungal infection or it could be, what say? Psoriasis. Is that it?
Sorry, sir.
Psoriasis.
Yes.
So minimum, you could say that it could be psoriatic nail dystrophy or onychomycosis. Okay.
Yes. Yes.
But it is not paronychia. Paronychia will be around the nail bed and other, right? So like this,
Yes.
you understood. Now, how to differentiate? You are thinking that psoriasis and other. So now you go back to the discussion or the text. In the text, you identify there is itching at the groin. So itching in the
Yes.
groin leading us to say it is psoriasis or fungus.
It's fungus.
So this is the answer.
Yes.
Clear now?
Got it, sir.
So actually, I like to share you the technique of attempting picture-based question. You may have better than me also, doctor, no problem. I will appreciate you. Anyone can discuss. But this is our standard way of teaching or whatever say. I'm sorry to say not teaching, guiding you rather, okay? I'm sorry. I don't feel I'm a very good teacher. So
Thank you, sir.
this is the technique. So you see now, I will tell you the basic of designing the question, the picture-based question. Now I will tell you now the pictorial question concept and design, how the examiner set the question. You see in the picture, so you are telling by looking the picture, you can say that there are some reddish rash in the leg, right? Doctor, where is Daniel? And
Yes.
Dr.
Yes.
Amena
Yes.
also.
I'm with you, sir.
Anybody can share. We are in a small group discussion. So you can say that this is a male or female. Can we say? Maybe no.
Yes.
Maybe
We
no.
cannot.
Maybe no.
Yes.
So this patient, they are also telling this patient. They didn't mention because male female is not the matter here. Matter is that patient having painful raised lesion. By looking the picture, you cannot identify this is raised or not. But you can say that there is a red lesion. These are multiple in number, erythematous in the both legs.
Yes.
In the question in the stem, they didn't tell the messages. These are in the legs, these are like this, because they are telling you this message in the picture. Okay?
Yes.
Okay. So those who are available in the picture, they will not tell in the text. So this is the technique. But actual question could be like this. If picture is not there, there is a painful raised erythematous lump on the anterior lower limb. If picture is not there, right?
Got it.
So we actually give a strict mark there because without picture it could be. Now you can compare, doctor, which will be easier for you, with the picture or without the picture? I think with the picture is
With the
easy to
picture.
diagnose. This is very interesting, enjoying part of the AKT exam. For this reason, we usually convene in the recall class separately, pictorials, maybe X-ray or others. So this is the way of understanding. So look at the picture first and go back to the previous messages that is given in the text. Thank you, Dr. Daniel. Take care. Maybe you have some noise surrounding Dr. Daniel. So
You're welcome.
cotrimoxazole recently prescribed means they're asking about the drug related issues. Drug related. What is the diagnosis? Who can say here? Like this way? Painful raised lesion in the leg, erythematous already in this patient. Who can say the diagnosis? Cotrimoxazole causes this problem. This is a lumpy. That means the elevated lesions. Painful means tender. Who can say? Erythema nodosum. This is erythema nodosum. So one of the cause this drug. So this is the way. So in the pictorials, you need to learn, doctor, I will not tell the X-ray and other because we already have available basic discussion of the X-ray, but how to learn the X-ray for the exam purpose. We told before also, basic principles first you need to know, but those who have enough basic principle of X-ray evaluation, you directly can go to the X-rays in the AKT. Okay, wherever available, look directly the AKT related exam X-rays. Okay, it will save you time. Those who are a little advanced. Similarly, in the ECG also, those who have enough basic principles of ECG evaluation, you need to go through the ECG in the AKT directly. Okay, but we told before also that we have two pattern of discussion classes are there in the module also. Basic, that is the master classes, and the AKT, directly AKT related available ECGs. So those who are newer, we advise you to go through this both, not only ECG in the AKT. It will be very short process. And I told you that if you want to cross the road in a short way without going to the foot over bridge, there may be chance of accident. Okay. So this is the strategy. Then you are ready for the exam. So text-based questions and then the learning materials finished. Organize your learning materials now. That means what we said now until now, this is our pattern of organization. You may need different organization also according to your needs. Suppose you are the master in the X-rays or ECGs because you're working in very specific environment. So we'll go through this thing later on. Okay. You are master in your clinical practice. For example, maybe you are the medicine specialist also. Okay. Many of you, I believe that maybe planning for appearing for MRCP also. So you have good enough knowledge and other thing. So you have to reshuffle your organization. But what we said until now, many days we are guiding our candidates, and some of you have seen them also in the last session. They have passed in this way mainly, so far I believe. So organization is very important for you now. So until now, I believe that all of you are able to understand what we like to say. So even then, anyone to share something, you could raise the hand or open the mic to ask. We have something more also for you. Remaining thing will be, we will show you how to allocate your time system wise. We will show you. Anyone think, doctor? Nothing.
Yes, sir.
Yes,
I have a
yes.
question.
Please.
I'm in a training program here in Pakistan,
Yeah.
which is a 2-year structured training program of MRCGP International.
Right.
And by the end of 26, I will get my experience certificate.
Okay.
And I'm planning, to appear right after 26.
26.
So
Okay.
yes, so I need to take this like your course right now. Like I'm thinking I may not forget it.
No.
Like
Thank you, doctor, that you are asking. Actually, every doctor, every colleague need a individualized exam planning. Okay. I cannot say that the planning will be the same for each one here today as a new colleague. It depends upon your baseline preparation, storehouse of knowledge, like you, Dr. Daniel. Sorry, who Dr. Daniel
yes,
may be, right?
yes,
So
yes.
you are having very good training program there. Definitely your preparation will be better, no doubt. But those who are maybe, sorry to say, from my country, native country, they don't have any structured program till now. Okay. So definitely the preparation planning duration will be varied. Okay. If somebody needs 4-month, 6-month planning, 8-month planning, even the 12-month planning also. Because in the last few weeks also we advise some other colleagues, they have registered also our module, and sometimes they are telling that I will, for example, I will subscribe this 4-month or 6-month. But very frankly, what I was thinking that no, this colleague should need more attention, more time. Okay. Then I advise them, can you decide a little more subscription? Because it's a practical thing is that there's some payment difference also there. Sometimes we consider it about the payment and other. If anybody feels like having some help also, we are very generous to do. Those who got it, you know it. Better not to say more about it. So, Dr. Daniel, you think that in the next one, actually, we need to discuss each other personally. Okay. So
Yes, sir. Yes, sir. Thank you.
if everyone today ask me this question, I cannot answer one after another. So please feel free to talk to me later on how to decide yourself. Okay,
Yes, sir.
for your
So
planning.
kind of you, sir. Thank you so much.
But I understand that you are not very beginner. Minimum you are in a mid level. Okay.
Yeah,
After
thank you,
this I
sir.
can
Thank
come
you,
in
sir.
mid
Yes,
level.
sir.
Right.
Thank you, sir.
Yeah. Anyone other doctor to ask any other thing? Dr. Gunaratna, yeah.
I'm sorry, sir, but I'm a little bit depressed because I have done the exam. I lost 4 marks, right? I got 120, it was 124 was the passing mark.
Oh, I understand.
I didn't go any
Sorry.
classes, but I studied alone. Would you like to prescribe me some sort of method what you are doing here to go through this, or any? I studied whole lot, but I think it's something has gone. But what is the method you prescribe me, sir? Whether it's 6 months, it's too much for me for the classes. So I wish to apply for the next November 19th exam. So do you have small classes or any? I don't know, whatever the thing would you think?
Thank you, doctor, that you attended to this class. I can remember you also. You sometime attending our previous classes, but actually we didn't find you in our what I say the closed group, right? But I
Yeah.
remember you. I remember you. And
Yeah.
what you understood, this is the problem maybe in the technique. Stepwise, organized learning. You have gone through many things, could be. But for the
Yes.
question, what we discussed today, little technical thing. In every classes, we discuss it. Even in the system-wise classes, we already have given 2 or 3 sample of question today for today's discussion. But when you
Yes.
see the module, in the module, there are some systems open for everyone. This is not
Yeah.
restricted button. Maybe mainly from
Yeah.
the cardiology or dyslipidemia like this. Even
Yeah.
system mock also free.
Yes.
If anybody click the module, they will understand. So if you assess this thing, you will understand there is some technique of understanding for the preparation for the exam. So my humble suggestion for you that you need to adopt this thing. Okay. And the 6 months is not needed for you. So far I understand, as you appeared one time for the exam.
Yeah.
Again, I like to say I'm not very hardened. First, I'm telling or advising you that if you think that the knowledge is enough for you, but you are not actually up to date about the technique, I think 4 months is okay for you.
Okay.
Now,
Do you have
how to
classes
utilize?
things?
Yeah, doctor. How to utilize the 4 month? I will show you a little later. If you wait for few minutes, I will try to show you the module today also again. Okay. You just be waiting. How to decide the duration? Don't worry. Any other colleague to ask me now?
Thank you.
Otherwise, we can switch. No more question. Okay. So before the exam date, what will you do? The exam date, maybe suppose in the last time, maybe 14th May was the exam day. So on the 13th May, for example, what would you do? Somebody tell that don't read on that day. Dr. Gunaratne, is it possible don't read anything before the exam day?
I read, I read that painkillers. It means I had a problem of converting to pethidine to oral pethidine, and like the cereal they have put something. It was a little bit harder to me to
Could be many things
memorize.
could happen. Many things could happen before the exam day. And so what is the advice? Advise that don't be very serious before the exam day. This is the suggestion. And we don't like to say that be away from your exam because it is impractical. So our suggestion, don't go through the specific matter in the book because you will be frustrated. You never can finish A to Z before the exam day. So you will be very upset. Don't read this way. But in general, you are thinking that you are appearing the exam by the mercy of Almighty tomorrow. That's all. And try to get relaxed. Okay. Take a cup of tea. Don't more coffee or tea because next day you are having the exam. You need good sleep before the exam day. Actually, very difficult to maintain, but this is real. 6 months, 4 months, even 12 months, you prepared this thing. Why you are thinking to finish everything one day before the exam day? Right. It is very impractical, but we have done it even in our undergraduate life. So try to understand this thing, get relaxed mainly, and maybe chat with each other. And another thing in the exam day, if you don't know the answer at all, how to give the answer. Some of you possibly attended the discussion before. This is a link is there in the YouTube also. You will find it, may be available. You can see, but it is a very 11th hour advice. Okay.
Yes,
In
I
the
can
exam
remember.
hall, you can remember, might be this. Though
Yeah.
we may not be right all the time, but there's some already you can remember something we are right somewhere. If you follow the technique, somewhere
Yes.
we are right, somewhere we're right. So now that coming to this issue, many options in front of you. Suppose you are allied with us for that, some of you attended today's discussion. There are many other mentoring or facilitating groups are there in the world for many exams. So like this food dish, many dishes are there. It is up to you what you will choose according to your need. Unfortunately, if you have the diabetes, hypertension and other thing, will you choose this hamburger or other, Dr. Ratnayake or any other, Dr. Amena? What do you choose? It is your the native food. Possibly you might have this orientation in the abroad, but not in your home country, is it? Dr. Amena, where are you now? You are
Sorry,
very
sir, I had
acquainted
a
with the
patient.
fish, vegetable. Okay, thank you. Fish, vegetable, and other thing. But the Middle East countries, right? Many things are there. Anyway, so how will you choose? It depends upon you. Which mentor will actually help you more? It is your decision. Which module will help you more? It is your decision. So if you ask that, should I be enroll with your program? So you see that practically we will have to answer that yes, but it may not be true. You need to choose guidance and other things. What support you need, you decide yourself. Okay, up to this. And for this reason, you make a round throughout the world in the internet. Okay, we are having our materials, we are presenting to you. It is up to you. Everywhere is the freedom, no problem. But you become puzzled. If you like this, many things are there. What you will pick up from there first? You might be puzzled. For this reason, actually, we took a discussion class, technical thing we discussed to you to decide. And this is our program already you have seen before also, and even in the group also like this, including the discussion class, relevant books, notes, recall classes, 2 set of system mock. Okay. And almost we are regular every week, almost, or 2-3 times in a month, we are having in touch with you. Okay. This is the module get up, and you can see, and you have seen also. And these are the topics discussed there simply to show you. And this like today feedback session and other sometime we sit together. So near about more than 75, and this 75 class will be more because you know that we told you some extra classes we are arranging in future. So this is also again dynamic lectures count, rather to say. It will not be fixed in the module, and others it will be updated day by day. Even in the last time, you can remember that Dr. Mona maybe on that day or someone said in Arabic, the 12 recall classes are there, or 10 recall classes are there at their time, those who are preparing before. Now it is updated around 50 recall discussion. Okay, and it is growing. Growing means in the next AKT exam also, by the mercy of Almighty, we believe that we will arrange again more discussion class on the recall. Very right. But the mock, if possible, we will increase. But we are very alert not to give you more burden, so that you can prepare yourself within a reasonable time. If we add more learning bundle, for example, 3,000 to 4,000, 4,000 to 5,000, then 6, 7,000 questions are there, it will give no extra equivalent benefit. Remember it. I am using the word equivalent benefit. But for development of the understanding, 2,000 questions are enough. Even it was before, somehow, I don't like to say unfortunately, there are some the commercial or other business issue also. So increasing the number may be a trending to tell us that we are increasing the number of the questions, but actually cutting your valuable time in your life. It is also true. So don't think that if you go through 10,000 question will be the most valuable or beneficial for you. I don't like to say in this way. As a mentor with my experience, because we passed the AKT, so far I can remember maybe 1,500 or at best 2,000 question, not more than that. Nowadays it's become maybe 3,000, but someone having the more than that. So this is the technique also, again very carefully. So we will not increase too much material here. Maybe modification could be there, including some master classes. The color contrast is telling something. We will have some masterclass specifically in future by the mercy of Almighty, immunology, travel medicine, and others. So all of you will be invited there. More likely it will be the open session. Okay, not confined with our registered doctor. So everybody will have the chance to attend. So in the left side, these are the list. And we divided the topic in this way: systemic clinical topics, topics on the life stages, women's, men's, and child. And in the last class also, I can remember nowadays, someone passed, she told that the women's health, the question from the women's health are more. For this reason, you see, we selected around, and we have done already 7 classes from the women's health. Before it was maybe only 2 classes. In the child diseases, 5 classes are there. Okay. In the men's health, sexual health, the 2 classes are there. Likewise. So we have updated this module, and till now, we believe, as we arrange this thing, until now, the best possible module we developed for you for AKT preparation. Almighty knows well. Okay. And who will give the comment, it is up to you. Okay. So now look at the module. I like to say, if you have time, doctor, be with us few minutes. Those who didn't see, even then, Dr. Amena, can you see the module in the screen?
Yes, sir.
Fine. So this is the module. If you start with this, these are the contents. And everywhere you will get the link there, how to go through the module. Records are there. And this is the books, okay? And all of you have the chance. Those who still didn't subscribe, these color boxes are free, rather to say. AKT syllabus and exam preparation. Everybody feel free to click it and see it, okay? Everywhere, it is open. And if you come to the system, I told you that cardiovascular, we kept some button open. These are the color. You see, master classes and the ECG in the AKT and the CVS discussion. These colors, one system mock also, this is free. You see this color, greenish color. Huh?
All green colors are free, sir?
Yeah, it is right. And for this we mentioned, you didn't see, maybe you see, we have written in the first page, these colored boxes are free. Okay. So we tried to give you the message. So who want to evaluate hours activity, you feel free to judge, right? We will feel better also if you comment us that this is wrong, this is right, if you say. So somewhere we have given some, these color free boxes are there. Like this in the somewhere, some system, not all, because now you very understand that you have to subscribe to get the full access. But many system you see in the right side, these color boxes are there. Everywhere almost. In the master classes all are free, anywhere. So if you come down, if you finish it, so how to comprise the system? For example, again coming back, cardiology, after finishing the lecture, then go to the solve question bank. Okay, before see the relevant slide, question bank, attempt system mock, then you are ready. Then make the queries and put in the group. Okay. So anyone to see how to attempt the system mock? Doctor, anyone? It will take 2-3 minutes time, maybe 2 minutes. Anyone to see?
Yes, sir, please, sir.
Why didn't you see before we provided you the module, doctor? For example, respiratory health. Okay, because we have the access. Look at this system mock, this one. I'm clicking there as we have the access with our Gmail ID. So we are opening it. This is the question. If you want to enlarge this, you go above the button and make this zoom so bigger. Okay. So customize with your screen and then come down. So there are some instruction, total 20 question, and how to mark there, mention there. Preferably keep a paper record later on. Huh? The A, B, C, D like this to write down. So 1 is there, 1 point for each question. And this is the answer. This is a question paper for you. So, sorry. Few seconds, doctor. It is a technical thing. So in the 1, you are giving the answer A, for example. Answer A. 2, answer B. Dr. Amena, can you follow? Anyone,
yes.
please? Okay. So likewise. And we told before that, you know, in the Google forming, there is some system that you cannot submit without answering. But in our question, we open this restriction. We relieve the restriction. The reason is that if you miss your question, this is your mistake. Nobody will tell you that, doctor, you have missed question number 7. For this reason, we are not guiding you. Okay, we are trying our best to make the mock as a real mock in the online fashion. And those who will be appearing the online, definitely you have to click in this way. So up to this, I'm going down, not to answer every, maybe randomly, for example, I'm choosing 5 or like these, randomly A, B, C, whatever. So 5 or 6 question we attempted, including the picture also. Okay, and going down. This is a respirology question. Finally, you submit this form. Okay, if there is a required question, what required question? We need to enter. That means in the before I didn't enter the Gmail. For that they are asking my. If I started with this, they will not ask. So suppose doamsbd@gmail.com. Okay, so I have done it. So I think now possible to submit, but they will not ask you if you miss any question. This basic thing, your identity in our form. So submit. Now it is submitted. Clear, Dr. Amena? I think clear. Other colleague also. Now you come to see the score, view score. So what is score? So we have got 2 and correct answer. So 2 over 20. Okay, 2 over 20. So question 1 was right. So this is a green mark, check mark. Maybe I got the mark. Okay, 1. This is a correct answer. This is the correct answer. If you come down 2, this is the correct answer. 1 over 1, you got it. Okay, then come down. What you didn't answer? You didn't answer. So you are not getting mark there. So if you have the wrong answer, for example, somewhere down also, I will show it. This is the wrong answer given. Okay, this is the wrong answer given, the red mark. But the correct answer in the bottom, correct answer would be D. It is mentioned there in the answer script. Now you could see the explanation in the answer. So this is that Google Drive again. You open there. What was the question number? Dr. Amana, could you follow? Maybe 4 or 5 question number. So you scroll down there, 4 or 5, for example. And then you could see the explanation and other things. What you have gone through before also, that is appearing to you, repeating your memory. Okay. So scroll down, maybe 5, for example. So there's the explanation is there. So then again, go back, or you can keep this open also, because it will come later on. So if you come down for the next question, so you need to click it again. Otherwise, you can already in the computer tab, it is available. You go there. Then go to the number 7 or 8, whatever you see, explanations are there. So in this way, this will be finished. And already you have seen that you got 2 over 20. I believe that you will get minimum 10, right? Don't worry. For sample, I have shown it there. This is the way. So your system mock is finished in this way. So it is a very dynamic digital system mock. Okay. This is until now we developed up to this. It will be very useful. And then you go back or you finish it. Okay. You finish it and go to the module again. Similarly, other things also there. Very simple. Only click there, you will get it down. So before this second, I told you the step 2. The step 2 start with the mock set 2. This is the mock second set. Is a different question, not the same question. The source are different. Okay. So there are again maybe 50, 70 per system also there. So in the second mock, so only directly you try to do it. Likewise, go down and finish near about 21 mock are there also in every set. Then now you definitely you would improve and then come there. The recall. In the latest recall are there, you see in the down. Pictorials and others. Those who attended, so you will have your store until you appear the exam according to your subscription. You can repeat it also. But mock will not be repeated. Mock is mock. Which is gone with your ID of the Gmail ID. Okay, so more mocks are there. Don't worry. If you finish the previous mock, tag with the system, then you are getting the second set of the mock in the as the final preparation. So mock question will be enough for you. Okay, there may be what about 1000 or like these, maybe I can remember. So and then complete mock. 200, 200, 400 complete mock there. Already we described before how to appear. So finally, this is our wish to you. So this is actually the get up of the module. I think I can close it now. Is it? Dr. Amena, anyone? Can you see the PowerPoint now? Please. Doctor,
Yes.
help me.
Yes, sir.
PowerPoint? Okay. Okay, fine. So this was the module issue. Now, again, final thing, as we discussed, and we actually, it is our thing to invite you also, you know, that we described the module, all the contents are there, including the subscription plan. And Dr. Amena or someone, Dr. Ratnaik may be asking, what will be the duration? Okay. And in the module, sorry, I think we mentioned the duration. I forgot to tell you. I'm going again the PDF. Can you see the PDF? Dr. Ratnaike or anyone? Can you see the
Yes,
PDF?
sir. Yes, sir.
So one thing I missed to say, in each system, we tried our best to give you a time limit. You see D1 up to 6. Okay. D1 up to 6. That means our plan or advise you to finish the cardiology within 6 days. It may be plus 1 day more, no problem. Even 1 day, that means plus minus. Those who are experienced, enough, knowledgeable, it may take even 5 days, no problem. This is only assumption. Okay. This is our plan. And the second system, learning materials are less. So 7 to 10, maybe 7, 8, 9, 10, 4 days. You understand the bulk of learning is less in the respirology. Similarly, 4 days again in the digestive system. Likewise, we arranged and we have calculated that to finish everything in very regular manner, it will take around 120 days. That means 120 days means 4 months, right? 4 months, including the mock and other. So it may be plus minus something. For this reason, actually our plan to advise you, it should not be less than 4 months for any candidate. And we discussed and explained to you also, those who are very expert, even you passed MRCP or other, practically, I am also, I like to say that I have done preparation MRCP earlier. Then I appear for the MRCGP. So with my personal experience also, each exam has its own unique pattern. You need to adopt it. Whatever you're the master, it will be very risky to ignore the exam system, whatever the easier you are thinking so. For this reason, to grasp our learning material, minimum, it will take 4 months. Dr. Ratnaike, I think you got your answer now a little. Dr. Ratnaike. But again, those who are the middle level, minimum you can extend up to the 6 month. Dr. Daniel was there before. So if you are having the training, you are up to date. If you didn't appear exam before, so I don't like to advise you for the 4 month. You might have 6 month minimum. Okay. Those who are very
Okay, sir.
beginner,
Thank you.
those who are very, what I say, beginner rather to say, never got any orientation before, definitely I advise you 12 months. And already some colleague started with this 12 months. They don't have any plan to appear the exam in this year. Okay. Maybe in the coming year. So 12 months. So accordingly, you will design, but our calculation here given is a minimum calculation. Already I have shown you system was 5 days, 7 days. We calculated this as a minimum duration. So those who are planning 1 year, so you make it double, and definitely double, because you will be busy not only for the study in the 12 months. You may have family work and other even marriage also, for example, those who are very younger and bachelor, right? So it maybe we have to match with our practical life. For this reason, we divided the slot, but the content is same. Content is same. Right, doctor. Any further technical question like this, doctor, from this planning? Dr. Daniel asked, Dr. Guna Ratne also. Any other colleague to ask anything from here? Maybe no. Maybe no. But what we like to say you now that somebody requested us, or sometime we observed that might have some financial issues and others. Sorry to say, personally, you feel free to ask. We don't mind. Okay, but we appreciate that you are in the line of family medicine, having a dream of being a family medicine specialist or consultant in future. We are the part of your journey. This will be our great pleasure. But accordingly, we cannot provide everything in the free of cost. It is also true. But you have to be responsible. You have to develop the accountability. For this reason also, you have to pay something. Okay, so some colleague or other colleagues wanted that it could be, if the cost is less, it will be comfortable. So we are considering this thing. So don't worry. And by considering, actually, immediately before, I was thinking to invite you in this module with this, maybe comfortable for you, with the 30% discount for you. So we are inviting, I think it will be easier for you, whatever you select the duration, and we will be providing first 20 candidate to provide this opportunity. So you feel free to communicate with us. For this reason, we develop a Google form. Okay, this is the Google form. And I think I will feel better to share it with you in the even the here, so that immediately if you want to fill up the form, you can do it. I think all of you can see in the chat box of the Zoom. Link is a longer one. So if you want to fill doesn't mean that actually you need to pay there. Don't worry, doctor. You just register your name there. You can pay later also. But we need to make a sequence of 20 doctors to connect you. You will have the privilege to get it with the reduction. For this reason, we made the link. So you will get the link, and link will be available in the WhatsApp group also, no doubt. But those who are free, you can see there very only 2 or 3 informations you need to see. We will make a sequence there according to the time. Okay. So this is the thing. I think you don't have further query also, and this is our contact. Always, and most of you are possibly in our members. So I don't like to pick it up the link in the group. You can ask your friends also. So that's all from today, doctor, and thank you very much, and wishing you the best for your AKT dream. And by the mercy of Almighty, we will be with you all the time until your exam. Thank you very much, doctor. If you don't have any other thing to ask me, we like to conclude.
Thank you, sir. Thank you so much.
Okay. If anyone have further also, nothing so far. No further question. That's all. All the best. See you, and keep your eyes in the group regularly, doctor. You are getting learning materials, PDFs. So in the daily time, maybe different materials are there. Usually we provide the early time, different slides related with the topic. More slides are there. Then some PDF material, even some videos also, including our this informations, course related informations are there. So be in touch and be in study. Okay, our humble suggestion: don't distract yourself from study every day. Every day, minimum 1 hour minimum. Be busy with your study. Okay. Thank you very much. Thank you very much. All the best, doctor.